Good afternoon, I'm student Dr. Cardona.
Hi, my name is Andres.
Hi, Andres. So, tell me what brings you in today.
So I have for a month. I've been having uh, pain on my right bottom foot,
Okay.
more towards the heel.
Okay.
Yeah.
Okay, Andres, is there any injury that might have caused this pain?
So I'm a retail manager.
Okay.
So I'm a lot of hours standing,
Okay.
and I probably don't have the best shoes.
Okay.
So I think those are the factors.
Main
that,
factors.
Yeah.
Okay. If you were gonna describe this pain, would you say it's sharp or dull?
Sharp,
Sharp, and is it constant throughout the day?
constant. Yeah.
Constant. Okay. When referring to this pain, is it localized to the bottom of your foot or your heel, or is it radiating towards any part of the body?
Localized towards the heel.
Localized towards the heel. Is there any factors that alleviate this pain or aggravate it?
So when I take ibuprofen,
Okay.
it alleviates pretty much, but
Okay.
it goes back when I'm standing up a bunch of hours.
Okay.
It really goes
Yeah.
back to
Back to pain.
pain. Yeah.
Okay. What about the morning? When you wake up?
When I wake up, my first food that I put, there's pain. Yeah.
There's pain. Okay. Okay, Andres, if you were gonna categorize this pain on a scale of 1 to 10, 1 being the least amount of pain, 10 being the most, what would you describe this
So
pain?
when I first put it down, it's 6. When I'm
Okay.
standing on but good amount of hours, it goes 8 or 9.
8 or 9. Okay. Okay, Andres, now I'm gonna ask you about your past medical history. Have you had any hospitalizations or surgeries?
No.
No? Okay, any childhood or adult illnesses that I should be aware of?
No.
Do your family members have any illness, chronic
No.
illness? No. Regarding the medications, apart from the ibuprofen that you take for pain, is there any medications that you're taking?
No.
Okay. Are you up to date with all your immunizations, your vaccines?
No.
Okay. Any allergies that I should be aware of?
No.
Okay. Have you had any recent blood transfusions?
No.
Okay. Patient is alert, awake, and oriented. Okay, Andres, now I'm gonna ask you a little bit more about your social history. Are you married right now?
Yeah.
Yeah. Are you sexually active with your partner?
Yeah.
Okay. How's your sleeping schedule looking like?
6 to 8 hours.
6 to 8 hours. Okay, good amount of sleep. You told me you're a retail manager. Regarding your exercise and diet, how is that looking like?
I try to maintain myself active. Diet, it's not the best. I work in retail.
Okay, yeah, I understand.
Yeah.
It's difficult. Do you smoke any tobacco or do drugs? No. Do you consume alcohol?
Socially, so when I go out, if I go out,
Okay.
2 to 4 drinks.
2 to 4 drinks. Okay. Do you have any pets at home?
No.
Have you done recent traveling?
No.
No. Okay. Now we're gonna go to the physical part of the examination. You're gonna scoot back to the end of the table. I'm gonna start with your vasculature exam, testing out your dorsalis pedis pulse. 2 out of 4. Check your posterior tibialis. 2 out of 4. Good pulse. Now I'm gonna check your popliteal. Flex your knee for me. Okay. 2 out of 4. Good pulse. Okay, you can bring it down. Next leg. Let's check your popliteal here. 2 out of 4. Good pulse. Okay, now I'm gonna check your skin elasticity to assess hydration. Good hydration. Good hydrated skin. Okay, let's check your capillary refill time. Okay, everything under 3 seconds. Yeah, everything under 3 seconds. It's normal. Temperature, we're gonna assess the temperature of your skin. Warm to warm, there's clear signs of hair growth. Clear signs of hair growth, which indicates good blood flow circulation. Okay, now we're gonna pass on to the dermatological part of the exam. I'm gonna examine the front of your legs. No signs of wounds or maceration. Let's go to your dorsal part of the foot. No wounds or macerations. Bottom of your foot. No wounds or macerations. Check behind your leg. Just raise it up a little bit for me, thank you. No signs of wounds or macerations either. No signs of wounds or macerations in the other leg. Okay, now I'm gonna check your interdigital spaces and nails. Okay. Interdigital spaces seem good. Nails, normal trophic, good, healthy. Digital spaces in the other foot. Nails, normal trophic, healthy over here. Okay, now we're gonna pass on to the musculoskeletal part of the exam. For this part, I'm just gonna push against you, just push back against me. Okay, push down, good strength, push up, good strength, to the side. Okay, push inside, perfect. Okay, now I'm gonna assess your joint range of motion. I'm gonna start with your right foot. I know this is the one that is a little delicate, so I'm gonna try to be as delicate as possible. Assess your first ray of motion. Okay, your range of motion. Assess your mid-tarsal joint. Your range of motion. Your subtalar joint, put it in neutral. Your range of motion. Ankle joint. Normal range of motion. Okay, flex your knee for me. Do a range of motion. Okay, so your other foot. Okay, first ray range of motion is good. Mid tarsal joint, good mobility. Okay, let's check your subtalar joint. Put it in neutral. Okay, range of motion. Ankle joint, good range of motion. Okay, flex your knee for me over here. Good range of motion over here also. Okay, and then we're gonna pass on to the neurological part of the exam. For this part, I'm gonna touch you with a monofilament in 10 spaces. Close your eyes and just tell me yes when you feel it. Okay?
Yes. 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 Yes.
Okay.
Yes. Yes. Yes.
Okay.
Yes.
Okay. To the other foot.
Yes. 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 Yes.
Okay. For this next part of the exam, keep your eyes closed. We're gonna do sharp and dull. Okay, this is dull, this is sharp. Okay, just keep your eyes closed. Tell me dull when dull, sharp when sharp.
Sharp.
Yep.
Dull. Sharp. Sharp. Dull.
Okay. Perfect. Now I'm gonna test out your reflex, starting with your Babinski reflex. Okay. Start with your right foot. Okay. Okay, Andres, you can scoot to the end of the table for me. I'm gonna check your patellar and Achilles reflex. Over here. Okay. Patellar reflex. Okay. Now for the Achilles. Okay. Other leg, patellar. Okay. Achilles reflex. Okay. Just go back to the end of the table for me. Thank you. Okay, now we're gonna do a proprioceptive exam. When I pull up, just say up, and when I pull down, say down. Try to do it with also an enumeration of your digits, of your fingers. Okay, this is first, this is fifth. Okay,
Up 1.
up 1, keep your eyes closed.
Down 5.
Yep,
Down 1. Up 5.
yep,
Up 1.
yep. Okay, for this last part of the exam, we're gonna do a vibratory test. Just gonna cling it over here. I'm gonna put it against a bony eminence. Tell me when it's hot. Okay.
Okay.
Keep your eyes closed for me. Okay.
Stop. 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 Stop.
Okay. Okay. Let's go back to your main concern area, which is the bottom of your right foot, mainly in the Achilles. I don't see no signs of edema or inflammation. But regarding the history and what you told me, there's clear signs of plantar fasciitis, which basically, like you say, you stand long hours and it hurts even more when you're standing long hours. When you get up from bed, it starts to hurt. Okay, so this will be my initial diagnosis, plantar fasciitis. Differential diagnosis might be an Achilles spur or bursitis, but that would be later on diagnosed with x-rays. So for now, Andres, I'm just gonna send you home. I want you to rest don't put any strain on your foot. I'm gonna recommend you also, I'm gonna prescribe you with ibuprofen, okay? So take it as the pain goes.
Okay.
Also, I recommend, most importantly, get good shoes, good arch support, because that's gonna alleviate your pain even more. When you're standing those long hours, you don't want flat foot, because it's gonna provoke this inflammation of the plantar fascia. Okay, so apart from that, I'm also gonna send you to therapy so you can do some exercises to alleviate this pain. And also, I'm gonna see you in about 2 weeks. So if the pain hasn't gone in 2 weeks, we would order an X-ray for you, so we can rule out the possibility of a calcaneal spur or a bursitis. Okay. If there's any questions that you may have for me, you can feel free to ask away.
No, that's perfect.
Okay, thank you, Andres. I'll see you in 2 weeks.
Thank you.
Thank you.